Hello everybody, I'm Marlon. I'm a member of the board at Youth Against AIDS and responsible for our peer-to-peer education program. Today I'd like to give you the opportunity to meet Cameron Kinker. He's the Community Engagement Coordinator at U equals U, the Prevention Access Campaign, short PAC. And Cameron will be with us in a second here at the House of Prevention studio to talk about the AIDS 2020 virtual experience and everything he does for the U equals U campaign. All right, so let's welcome Cameron to the studio. Hey Cameron, good to see you. How are you doing?
I'm doing great. Thank you so much for having me. How are you?
I'm fine as well. I hope you're safe at home or at the office.
Yes, I have been working at home since early March in New York City, and thankfully still healthy and yeah, doing great.
Great. So how was your experience with AIDS 2020 virtual so far?
Yeah, I think it's been obviously challenging to try to transition a meeting of 15,000 delegates that was meant to be in person into an online experience, but I think with that, there's a lot of opportunities to include more people that maybe otherwise wouldn't have had access or been able to physically go to a conference in an expensive place like San Francisco. So I think hopefully this will be a way that we can continue to use these conferences as ways to share information with even a broader swath of people. And I think there's been some exciting news that's come out about U equals U and how people are using that information, which obviously I can talk about. But yeah, it's been great so far.
Do you think that could be a way of organizing and setting up conferences in the future as well? Or do you miss seeing people all around you?
Personally, I miss people. I'm a people person. So it's been hard being, with just stuck at home for a long amount of time. But I think, the in-person networking is always a huge part of these conferences, and seeing folks that you only see every 2 years or every so often. But I think also at the same time, we have to think about how we're prioritizing access and who can afford and has the resources to come to these spaces, and how are we, speaking about youth, fostering young people into this movement, and meeting them where they're at if they don't have the resources to travel to these types of conferences. So I think maybe a hybrid model in the future. Hopefully we can continue to see ways and include more folks in the conversation.
That's what I would guess as well. Yeah. The U equals U movement is present around the world, and Youth Against AIDS is a proud partner of this campaign as well. Cameron, maybe can you explain in a nutshell what the U equals U movement is about, and maybe even what the U stands for, because I think a lot of viewers might know, but maybe there are some people who haven't heard about the campaign yet.
Yeah, absolutely. So U equals U, as you can see on my shirt here, it stands for Undetectable equals Untransmittable, which means that a person who is living with HIV, who is taking antiretroviral medication and treatment, it suppresses the amount of virus in their body to an undetectable level. What that means is that they can no longer pass it on to sexual partners. There is zero chance of it being passed on when someone is virally suppressed. So this information was part of we launched a campaign in 2016, Prevention Access Campaign did, to help get this information out to people, because we firmly believe that all people living with HIV deserve access to information about their sexual health and their bodies, right? And we've seen the movement grow exponentially over the past 4 years. We have partners in 101 countries across the globe. About 993 individual organizations have signed on. And it's been, as a person who myself is not living with HIV, being, working with Prevention Access Campaign and kind of being behind the scenes to support partners all over the globe in helping to share this information. It's incredibly inspiring to see how it's changing the field and also changing people's lives and how they're able to love and live without the fear of passing it on.
Yeah, thanks for the introduction and explanation. Maybe what is your ultimate goal behind U equals U? So what would need to be happen for you to say, okay, we can stop the campaign now?
I don't think we'll rest until we feel that every person living with HIV knows this information, right? I think that this is primarily a human rights campaign, right? We view this information as a right that people have. So, we're working with health departments all over the world, with individual organizations, people across the HIV field to help give them the tools to share that information, but also to make sure that information is being shared responsibly, and done so that in culturally responsive ways. And then also, of course, using it for policy and advocacy, making sure that we can use this message to get people the treatment that they need, to get people into testing, because sharing this message with the general public will probably decrease testing with anxiety, or it does decrease anxiety around testing. Making sure that we can use this message to advocate for universal access to care and decreasing barriers to healthcare. So this is part of a movement that I think we'll see hopefully going on for a long time. But I think, we just really want to make sure that everyone has access to this information.
So you're about informing people living with HIV, informing the general public so they, lose stigma. But what is your message to policymakers?
Yeah, absolutely. This is something that we've increasingly fought for and are advocating for when we're approaching policymakers and folks who are making decisions about funding and healthcare and resources for people. We can say that this information improves the health of people living with HIV, but not all policymakers and folks, who control the funding and money always necessarily care about the health of people living with HIV. But what they do care about is prevention and ending epidemics and public health. So what we can say is you can take this message and you can prioritize the health of people living with HIV to get them to undetectable. And by doing so, you effectively eliminate new transmissions, getting us closer to ending the epidemic. And we view this as like the public health argument for universal access, that this message shows that we need to prioritize the health of people living with HIV, because that is the best way to get us to ending the epidemic.
Yeah, that's very interesting. And everything you say, it sounds like being quite a big task and quite a big challenge. And as you just told me before we started the session, you are only 3 people in your team, which I find crazy incredible that you have such a strong power and such a strong outreach. So what are your, apart from having limited resources maybe, but what are your biggest obstacles and your biggest challenges?
Yeah, thank you for that question. I will say also we have amazing partners around the globe, and ambassadors and folks who are, partnered with us, who are really responsible for the growth of the campaign. So, it's really, the community has really, taken this message and ran with it. So I have to, acknowledge their role in all of this, and people like you, of course, as well. I'm sorry, could you repeat the question again?
So it's a big task you have. And my question was, apart from it being a big task, what are your biggest challenges? Is it talking to policymakers? Is it talking to the general public? Is it talking to people living with HIV? Or is it maybe different regions which are more challenging than others?
Yeah, we exist in a field that has a lot of challenges. I think, obviously, the access question is really huge. We want everyone to be able to benefit from U equals U, but we know that not everyone has access to the treatment that they might need to get to undetectable. People, are dealing with all sorts of other structural barriers like racism, transphobia, homophobia, classism, poverty, etc., that prevent people from accessing the care or being able to access the care that they might need. So I think, our biggest challenge really is the challenge that all of us in the HIV field are facing. But also that we do see that sometimes providers aren't always sharing this message. There has been a number of studies recently that have come out that show that many providers don't share this information. There was a study that actually was announced this week from ViiV during AIDS 2020 virtual that showed that when providers are sharing this information with people, that it actually improves health outcomes. So we're seeing that there is a benefit for providers sharing it, but not everyone is. So I think that's a big place where we have a lot of work to do, is to educate providers and make sure that they are sharing this information with their patients.
Okay, so there's another group you have to educate as well, because the healthcare providers don't know what information is necessary to give out. That's very interesting. So maybe talking about, the current situation with COVID-19, how did it affect or maybe change the way you work, change the way you reach out to people and organizations?
Yeah, I think what this pandemic has shown a light on is what I think a lot of people in this HIV field have known for a long time, is that there are a lot of people that don't have the healthcare and the resources that they need to be healthy, right? And especially in the United States, where I am, that oftentimes is Black and brown communities, places like in the southern United States. So I think what it's shown a light on for us is that we as a community need to be doubling down on looking at how we can support people living with HIV, how we can make sure that they're getting information, that we're being responsive to the different types of communities that are most impacted, that we're being intentional of whose voices we're highlighting and uplifting, and just making sure that we are supporting people living with HIV more. There are 400,000+ people in the US living with HIV who aren't virally suppressed, right? Which means that they are likely more vulnerable to COVID-19 if their immune systems aren't functioning in a way that they would if they were undetectable. So I think what it's just again highlighted the disparities, health disparities in our country and across the globe. So I think we all just have a lot of work to do, and we're in it for the long haul.
Okay. Yeah, true. So before COVID-19, how do you reach out to young people? As you know, Youth Against AIDS is all about working with young people. We had a big hackathon last week where we gathered about 31 people from a few hundred people from 31 countries who joined forces and created project pitches in order to implement a new project in their region. And this was the first time for us to have such a virtual event. Usually we are out in the schools or in the field to talk to young people and to engage with them, or we gather them at a big conference like the AIDS 2020 conference. But how do you reach out to young people? What is your way?
Yeah, great question. Well, I do all of the social media for prevention access campaigns. So that's a lot of time that I spend engaging with people and retweeting. If you ever want to use the hashtag #U=you, I will almost definitely see it and probably like it or retweet it or share it. So I think social media is a great way that we've been able to reach people all over the globe that are doing different things related to U=you. But it's also through our partners, right? Like folks like yourself, right? How can we, amplify and support the work that you're doing to reach young people? I'm 26, so I don't know if I would necessarily classify myself as a young person anymore, but I
yes, you are.
was. So I think what we've seen also is that U=you kind of is paradigm shifting for the field, right? And I think that we need to encourage more young people to use things like U=you to bring in new ways of thinking. We're reaching the 40th anniversary of this epidemic, and I think we need young people to shake things up and say, hey, this is maybe worked 15 years ago, but this is not my experience now, and we need to be doing it this way. And there's, I think, so much opportunity for new ways of thinking, and we need to encourage young people to step up and be leaders. And then, of course, people that are in positions of leadership now, hand off the torch to some young people and allow them to come up with new ways of thinking and solutions. So it's inspiring to see the work that you're doing and young people, I think, across the globe.
Thanks. Yeah, maybe we can extend that invitation to the young people who are watching, and you can just give us a quick overview of how young people can support the U equals U movement, either your organization or just the message. You know, you said tweet or Instagram with the hashtag U equals U, but are there other ways of promoting your campaign, of supporting it?
Yeah, talk to your friends, talk to your family, right? I think that's one of the biggest ways that we've seen people really understand the significance and importance of this message. And that's where a lot of change happens, right within your community.
Yeah.
They're, of course, sharing on social media information. I have a U equals U face mask. So if you can wear it on your clothes, it's great conversation starters. Every time I'm out in public and I'm wearing a U equals U shirt or a button on my backpack or my face mask, people always want to ask what that is. So creating those opportunities for conversation. If you are connected to an HIV-related organization and they're not yet a community partner with Prevention Access Campaign, encourage them to sign on. When they do that, they get plugged into our network of organizations across the globe that are united in sharing this message and doing this work, and we're there to support them in that work. So yeah, just finding new ways to talk about it, share it, put your own spin on it. We've seen people take this message in places like the United Kingdom and have branded campaigns like Can't Pass It On at Terrence Higgins Trust, which is essentially the same message as U equals U, but just worded differently. So if there's other ways to word it that work better in your community, find new ways to say it. We just want the information to be shared at the end of the day.
Yeah, great. Thank you. Where can I buy the T-shirt?
We do have some T-shirts on our website. If you go to preventionaccess.org, there is a shop button. Some of them are on Amazon. This shirt was made by a health department in Chicago, Illinois. So there's lots of also just folks making their own T-shirts.
Awesome. That's pretty cool. Thank you. So maybe let's talk a little bit about the topics which are also a big topic at the AIDS 2020 virtual. If we're looking at the UNAIDS 2020 goals, so 1990 goals for 2020, it looks like we're not going to be able to actually reach this goal by the end of the year. What is your opinion about it? Like, where do we have to, step up the game and change something in the way we are doing it right now?
Yeah, absolutely. I think obviously the COVID-19 has put a little bit of a speed bump in that road to reaching those goals, understandably. But I think, the health disparity problem, I think, has just been continually is emphasized, I think, in how we're not reaching these goals. But I think we need new paradigms and new ways of thinking to reapproach these situations and think about them in new ways. And I think U equals U for the first 90, for example, for testing is not something that we think about very often. We think about U equals U as a stigma fighter and for that treatment access argument. But actually communicating this to people that are maybe interested in getting tested or are identified as folks that would benefit from testing outreach, communicating this message up front and saying, this is what it means to live with HIV. You don't have to worry about passing it on to your sexual partners. All you have to do is, take your medication, get your labs done, and we're here to support you in that journey if you are diagnosed with HIV. So being more upfront with that, I think, with the testing component, hopefully would then create a cascading effect down the rest of the other, two goals. So I think, being creative and again, looking to young people to come up with new ideas.
Yeah, I'm glad that you stress the importance of talking and involving young people, because that's something we are really focused on as well, since we're young people ourselves, but since we know that the next generation has to be involved in order to make sure that we will hopefully be able to reach the 95 goals by 2030. To wrap up our session, I would like to give you 3 short sentences and ask you to finish the sentence. You can get creative on this, but just be spontaneous. So I'll read out the first sentence, and you have some time to, to reply or to finish the sentence. First one is, if I could change one thing within the global HIV response, it would be?
It would be giving people in community more control.
Okay, thanks. Second one is to set up a successful sexual health intervention. All it takes is
empowering people with the right scientifically based information.
Perfect, thanks. And if you had, or if I, so as I'm talking as you, if I had the chance to tell all young people one thing, it would be?
That you can't pass on HIV if you're undetectable.
That's a very good question, and that sums up your whole campaign, which is very great. So thank you for that statement. It was really lovely talking to you, Cameron. I'm really thankful for this talk and all the insights you gave. And it's great seeing your campaign being so powerful all around the world with organizations like ours, but around the world supporting it. I think it's a very important cause and a very important topic. So keep on doing that, and I hope to see you around the AIDS 20 virtual conference area. Maybe we can chat somewhere, and I think you have a booth as well. Maybe you can tell us how we can find you and how we can reach out to your organization during AIDS 20 and afterwards.
Yeah, absolutely. And thank you for having me and allowing us to have this conversation. Again, it's we're a part of a global network of folks doing this work, and it's really up to folks like you to help us share it. So yeah, thank you. As far as AIDS 2020, yes, we can grab a virtual coffee at our NGO booth. If you go to the NGO booth section of the Global Village, which is free to access for anyone, you can go to the Prevention Access Campaign booth. It's the little logo on the right. You'll see it in the NGO booth section. I'll be there fairly often answering any questions. And then every day at 2 p.m. Pacific time, 5 p.m. Eastern time, I'm not sure exactly what time that would be in Europe, we're having live Zoom chats with folks in the U equals U movement. So we would encourage you all to join that. Follow us on social media. We're posting lots of updates about what's going on during the conference on there. And our website is preventionaccess.org. You can always contact us there as well if you have any questions. But again, thank you so much for this opportunity. And thank you to everyone who listened to us chat.
Yeah, great, Cameron. Thanks for the information and for guiding us to your booth. I'm looking forward for that virtual coffee. I'm not sure how that will taste, but I'm quite excited for that. So thank you, everyone, for watching, for tuning in. If you want to see some more sessions, you can just follow our Facebook page and stay tuned. And yeah, let's see you next time. Bye-bye. Bye, Cameron.
Thank you.